Good morning. It is our afternoon. It is my pleasure to be with you here today to talk about the social ecological model and the life course perspective. I'm really sorry not to be there with you all, but really honored to get to share this work, which is based on a presentation with colleagues, Dr. Prickle, Dr. Yuli, and Dr. Kamara we've done in the past, and work over time with a variety of colleagues. So the plan for this brief talk is to talk about the social ecological model and introduce it to you if you are not familiar with it. And then think about how that integrates with the life course model. And then really workshop how it's helpful to think about these two perspectives together to really illuminate areas of interest in research, policy, and practice. And then there will be an opportunity for you to practice and do something fun to really think about how this can apply to the areas of work that you're interested in, which hopefully will be followed by a discussion about what you learned and considered. So first to introduce you, if you are not familiar with the just absolutely very useful and wonderful social ecological model. So the idea of the social ecological model, which has been a really influential model in health promotion across so many areas, is that when we think about what impacts health and what makes us healthy and well, we really have a variety of levels in which that influence happens. So our interpersonal inside us, our genetics, our demographics, who we are, is influenced by the context around us, our families, our relationships, which itself is influenced by the community around us, the neighborhoods we live in, the spaces where we are, and then the organizations, of course, within those. So our healthcare organizations, our schools, the community organizations that serve us, and then all that is influenced by policy, right? So there's a policy level in which decisions that are made nationally or globally or within our, smaller communities, our location-based communities or municipalities can really impact things like access to healthcare, access to education, cost of various types of living, access to healthy foods, et cetera, et cetera. And all those really impact our lives and our well-being. And if we can't think about those all together, we really are at risk of thinking about individual level problems that actually have systemic types of solutions to build collective well-being in a larger space and in larger other policies and systems in which influence might be really important to solve individual level health conditions as well. So, for instance, if you think about the levels of the social ecological model, from the individual to the interpersonal to the organizational to the community and policy, if you think about the example of diabetes, often you think of diabetes as a lifestyle disease, especially type 2 diabetes, of course, as a lifestyle condition where an individual, needs to start eating healthier, make sure they monitor their blood sugars, et cetera, et cetera. But really, if we think about diabetes at that individual level only, we miss a whole variety of influences that can impact not only whether or not they got that disease, but then how they can manage it and be well with any chronic condition they have, and with diabetes in particular. So it really matters the interpersonal, the organizational systems, the community resources around, and the policies, again, that support access to healthcare or other aspects that might promote well-being. So this is, for instance, really important from some work we did in Hawaii, where we really looked at the interpersonal influences and looked to see individuals who are hospitalized with a chronic condition, what were the social networks around them, and what did they look like around the preventable conditions for heart disease and diabetes. And so really thinking about then how to think about those social networks and the people around them and help support it, and how we can build health promoting interventions. So this was one where we really thought about a talk story, which is a relational type of building understanding through trusted individuals and people sharing their personal stories about how they manage their heart disease and their chronic conditions, sharing those back with individuals, really trying to build a health promoting experience and environment, not just at the individual level, but through these relational aspects. And so this talk story intervention was really well liked by the pilot group that we tested it with. And we think really thinking about that is really important to build health and well-being and to build health equity, right, within vulnerable communities. And so if we think about then the levels of the social ecological model, this individual level diabetes or heart disease is really impacted then by interpersonal levels of social networks, and really thinking about, family and community and social network supports. But then of course there are these other levels that matter as well, as the social ecological model helps us see, which are the health systems around us. If people, for instance, live in rural or urban communities, and how access is to care in those communities, and then thinking about policies, for instance, at the state or national level that help support healthy environments. And so that's the social ecological model in a very brief nutshell, which I find to be a really helpful framework to thinking about how we think about the variables that impact health research, and that also impact how we understand where gaps might be, where interesting hypotheses can be built, and where research questions can be. And again, how we think about all those levels working collectively to really think about how we build healthy communities and healthy individuals within them. Another really useful framework is the life course perspective. And the life course perspective considers health across the lifespan, from the prenatal period through senescence, accounting for the interrelationships in biological, psychological, and social factors. So here are a couple of examples and definitions of the life course perspective. This one from Nancy Krieger says the life course perspective refers to how health status at any given age for a given birth cohort reflects not only contemporary conditions, but the embodiment of prior living conditions, in utero onwards. So at issue are people's developmental trajectories, both their biological ones and their social ones, with those levels of the social ecological model in mind, over time, as well as how they're shaped by the historical period in which they live in reference to their society's social, economic, political, technological, and ecological context. So you can already see where the social ecological model and this life course perspective might merge. Another good definition of the life course perspective is this one from Ku, who says life course epidemiology studies how socially patterned exposure during childhood, adolescence, and early adulthood life influences adult disease risk and socioeconomic position, and hence may account for social inequalities in adult health and mortality. Social economic factors at different life stages may operate either via social chains of risk or by influencing exposure to causal factors at earlier life stages that form part of a long biological or psychological chain of risk. So really thinking about how that matters over time, right? And so it's like at any moment, you're of course influenced by all these pieces of time preceding you, including your family's trajectories, especially your mother's from the past. And then differential life health effects according to the timing or duration of exposure to socioeconomic circumstances may provide important clues to really understanding our health and well-being. So here's a nice visual to really think about how different places really matter in terms of looking at our health across the life course perspective. So you think about, if we think about who influences our health and well-being, really different characteristics and organizational spaces influence our health at different times in our lives. So when we're very young, our family, perhaps our daycare, who takes care of us, can really influence our health and well-being. Then, of course, school becomes very important. And of course, our family had been so important. And now our peers step in and start to become really important to our health and well-being. Then we have our workplace in which we work, which of course is very important over the bulk of our adulthood. And then of course our individual behaviors really matter, but also in context with the family circumstances in which we find ourselves. And then of course family and caregiving can become increasingly important as we get older as well, where we may rely on our family members to help take care of us and to help us keeping aging in place comfortably. So if we think about the life course perspective, we can really think about our well-being across this array of ages and times, from preconception to infancy to early childhood to school age, adolescence, early adulthood, working age, middle age, and older adulthood. And then, when we get to hopefully be old, the oldest old called here, but hopefully we all will get to that phase of our lives. And so if we think about those, merging the two things we've just talked about, this life course perception, this perspective across time, really thinking then in these levels here, up and down, about individual, interpersonal, organizational, community, policy, and global, really thinking about how those matter over time. And really this builds a framework in which we can really think about identifying gaps and solutions, and really understanding where levels of influence might matter and matter differentially in the work that we do. So I find, and I think many others have as well, that really merging this life course perspective and the social ecological model can be really helpful. Adding the life course model to the social ecological model helps move it from a cross-sectional snapshot of health to a longitudinal really thinking of health over time and the influence of various factors on health in different developmental stages. And I know if you think about the talks you've already seen in this conference and meeting, together, you can really probably already think of how these really might fit within these models of the lifestyle sort of over the life course perspective, as well as those levels of the social ecological model. And while many researchers and practitioners do really think about these levels of influence, it's not always straightforward to apply them in practice or really think about how they organize in this really structured way in which, by laying it out really flat on the piece of paper with those different levels on both axes, can really help illuminate. And from a research perspective, I think it is important that a combined social ecological model and the lifestyle course perspective merged together can really help lead to interesting and novel hypotheses and improve the interpretation of results and ways to consider them. So if we think about diabetes, from that individual level, which we've looked at, we can really think about, it really, as often the research has looked at early adulthood. Again, our surveillance systems are ones in which we really think about health. It just gave a talk on health literacy. We really think about diabetes around how important it is in early adulthood, and then growing really into over the life course from that perspective. But there's a lot of other ways in which we can think about diabetes and where influences might really matter to build meaningful places in which people can manage their chronic conditions, such as diabetes. So one way in which we do this is with diabetes self-management programs, which help teach individuals how they can healthfully take care of their diabetes and manage it within the context in which they live, and that these are reimbursed by providers and delivered in health systems of meaningfully, culturally relevant and important places in which that information is delivered, and people can build part of a community that helps them understand how to self-care, right, for their diabetes. And so if we think about then drawing those diabetes self-management across these levels, those typically focus on adults, and typically focus on within healthcare organizations, and then the policies around reimbursement in particular. But as a really important analysis we did here in our context here in Hawaii, led by Dr. Perkel and our evaluation team here at UH showed, they really went and talked with people about these diabetes self-management programs and where the gaps were and what those gaps looked like. So they found, interestingly, when they talked to people, there were these lifestyle specific concerns emerging as themes that really mattered on both ends of the demographic spectrum across the life course. So they found, when they talked to people who were running these diabetes self-management programs, that there was a preoccupation about diabetes that was also at younger ages, right? There's this new emerging, more and more people are getting diabetes at earlier ages, but there were really limited services for diabetes in youth. So they're saying diabetes can start at very young ages, and all these young folks this doctor was seeing are like 10 years old, and they're going to be dialysis patients, right, in that middle-aged part of the life course perspective, but there weren't resources really to help support them in terms of this diabetes self-management because they were really designed for adults. And so they can only be taken into these programs if they're 18 years and older to really have this training. And there's really nothing for kids and no support for kids and their parents. So that's a really important way to think about and use the life course perspective to identify some gaps. They also noted in these programs that there were limited engagement with older adults, so that older adults really reported home, environment, and interpersonal issues around service provision. And so, for instance, somebody who is older can't really necessarily sit through the diabetes class and may not be able to care for themselves related to the class and the things that they learned because they aren't independently living, right? They're living in collaboration with a caretaker who's helping them do well. And maybe those classes won't grab their interest, right? It's really not designed for that community. And so maybe the better person to talk to or somebody to do that in collaboration with would be the caregivers. So if we think about this model of what we've drawn, here was what we had identified as these diabetes self-management, helping support the individual through healthcare organizations, delivering these diabetes self-management programs, which very nicely were funded and could be freely taken without cost. So that's really important. But if we think about identifying gaps and what that might look like, we see this gap for people at younger ages. Also this interpersonal gap for the people that are older, really needing that caregiver to be part of those conversations, as well as earlier engagement at the organizational level, building spaces in these programs for young people, and then building policies to support them. And so what evidence is needed to do that? Do we need more information about younger people who have diabetes and what that looks like to help justify supporting such programs? So I wanted to give another example, which I think really feeds into the meeting that you guys are all a part of, which is the MES study, the International Mobility and Aging Study. I was not a part of the study, but Dr. Perkle and Dr. Kamara, who you can see here, were part of the study, and I believe that's where they became colleagues and collaborators. And I also think this example really shows relationships across time around how we build scientific understanding and how we build new research questions and new collaborations and what those look like. So this program, you may see some other familiar faces there. The goal of this project, which probably started about a decade ago, Dr. Kamara can confirm if she's there with you, but really the goal was to investigate factors contributing to mobility loss among older adults from different socioeconomic settings. And as they did this, they really thought about this work within the context of both the life course perspective, as we talked about. So you can see one of their models, the life course perspective. And then here's another way to look at the social ecological models, that individuals and their biologies and behavior were really embedded within families and friends, and then within the communities in which they worked. And then also they were doing cross-national comparisons. So really thinking about policies and systems at the national level and how that might impact the well-being of older adults. And so MES was here really thinking about older adulthood and really starting to think about how middle age also might impact that and what those communities look like in terms of building to older ages. But as I think you've probably talked about already here, this really bled into the AMOR project, which Dr. Kamara and Dr. Perkle, from their experiences in looking at older adults and really thinking about, wait, I think some of these things we're seeing here really are happening from earlier life experiences. And so the AMOR project really focused on looking at teen pregnancies and how that might impact chronic disease and other things over the life course, especially seeing that in older age, but really backing it out and trying to understand, what is going on here? What might be the reasons why teen pregnancy would be so impactful into older adulthood, and what might be the hypothesis? What can they understand and learn around trying to unpack the different ways in which those pathways might matter across these levels of the social ecological model and across different parts of the lifespan. So I think that's a really exciting area of research, and really thinking about this project, which I believe you guys have already talked about, but I think it really highlights this importance of the social ecological model across the life course, and really using that perspective to understand what matters, and how health and well-being are achieved and built and understood. And so these biology behaviors related to social contacts within neighborhoods and communities and within the society in which we are. And then adolescent pregnancy goes through those things to have an impact on long-term health effects. And really thinking about then where those might be, determining factors, and then how different pathways by which influence might be built through social networks and social support, through aspects like intimate partner violence, physical environments, social demographics, lifestyle and health behaviors, and attitudes and beliefs really might impact long-term health. And then to the degree that we can understand those, how might we build protective systems to help individuals then, whether or not they have an adolescent pregnancy, achieve good impacts and good outcomes across their long-term lifespan. So the life course perspective in the social ecological model, it is challenging really to think about all these different levels of influence, especially that they might interact with each other. And it's hard to do research to really think about, studies that do this across, all the possible times in a time period and across, all those factors, right? That might be prohibitive in terms of logistics and cost. But really thinking about where your work is positioned and where the most important factors might be and where the gaps might be can really help you think about what might need to be done to resolve those gaps. What are interesting hypotheses, right, related to what we see the influence at one point in time related to other points in times, and where there might be opportunities for public health successes and goal setting, right, about what we might hope to achieve. So the Amar project, for instance, really has added some nice pieces, and then added the research and experience we're really having today, which is really thinking about, okay, one of the things we really want to understand is obesity in early adulthood, especially related to teen pregnancy within the Latin American context, and then how might that impact health and well-being? What are the influences of that? What do they look like? How could they be influenced? And then how do we think about building health and well-being over the life course? And so then I sort of highlighted here with these stripy things into there, some other spaces then in which research might be done more about, for instance, different policy levels and what might impact health outcomes. And then, this real gap between, what is happening in these spaces between middle age and older age. And again, how we can build healthy communities, environments, and spaces in which people can live, work, and play in ways that keep them healthy, sort of regardless of what earlier life circumstances are, or, to help support them through the challenges of those circumstances when they were younger. So just thinking about some examples and ways in which you could use this perspective is that you can think about it in research. Is one interesting thing might be to examine 3 differently aged cohorts, right? To see how health impacts matter and how different levels of influence might matter differently over time. Thinking in terms of policy, really thinking about countrywide policies that target certain groups, for instance, older adults, but might expand to other age groups, right, to build health and well-being as well. And then in practice, really thinking about these person-centered health systems, for instance, like our example for diabetes control, like that's a really practical program built by our Department of Health and supported by our Department of Health. So really, how do we think about those sort of work like that in practice, and how do we make sure we're targeting with that type of public health practice exactly the right spaces in which to build the maximum impact for the most people? So all that is hopefully a fun introduction of the levels of the social ecological model and thinking about what those influences might be at the individual level, at the interpersonal level, at the organizational level, at the community level, and the policy level. And so what I will turn this over to is for it to be your turn and really give you some time to do an activity, which is thinking about where your research or program or policy focus is, and think about how you can study the social ecological model and think about the social ecological model across the life course in a way that helps illuminate the gaps, opportunities, needs, and goals that you might set for the research and care you want to do. And also think about challenges, right? What that might look like to try to find the work that might be relevant to the work you do. Is that research possible? What would we need to achieve and think about to get to a place where we could look at the sort of research needed for the work that you do across the lifespan or across levels of the social ecological model. So the idea of this activity is you really think about where your work focuses now. So for instance, if you have a school wellness is very important to you and you want to build a school wellness policy, you think about, on the levels of the social ecological model, go ahead and use a pen to draw that in, right, where that work would be, like right with adolescents. And then you can think about where else you might like your program to focus. Maybe you have school health wellness that's happening, for elementary school kids, but maybe you think that needs to go as the children become more independent and become more, making their own health decisions. Maybe you need a school wellness policy that really goes into high schools or higher levels of education, or maybe it needs to really expand into families, right? It's sort of so going down on those levels of the social ecological model. So in the areas in which where your work is right now and where you're doing the work, go ahead and darken that in and then build the space and use the social ecological model to think about spaces in which you may be able to think about other opportunities for research or hypothesis or programmatic work that you might do. And you guys feel free to, if you want to break into small groups to do this, or to break into small groups to after you do it independently to talk about it. So I will let your group leader help you decide what makes the most sense for the moment that you're in about how to organize yourselves. But then as you do this, really think about an opportunity to then have a dialogue. What can doing this work and really thinking about where your work fits into this model help you understand where there's work to do, needs, gaps, successes, and goals, and lessons learned. And also you can reflect on all of the things you've talked about over the time you've been at this meeting, really doing this workshopping around these important research questions and topics here presented, where those fit into the levels of the social ecological model and the life course perspective across and up and down, and really thinking then how to position, impactful change in those spaces in different policy levels or in different influence levels. So that is the end of my presentation, and then I hope you'll be able to break up into small groups to work on these activities, to really think about how this model and this perspective can be helpful to you. And really mahalo, that means thank you here in Hawaiian. To mahalo for your time. Really grateful to be part of some really wonderful teams, including the Amore Project, our work we do with the Hawaii Department of Health, and the Fulbright program, which helped me engage with some of the MES community as well over time, for which I am very grateful. So thank you so much for having me today, and I hope you have a wonderful time at this event. Aloha.